Hi, I'm Dr. Barbara Beyer, and you're about to view a short video about your baby from the doctors here at Washingtonville Pediatrics. Let's start with a look at how your 9-month-old is developing from our friends at Simply Parenting.
Yeah. 9-month-olds are definitely evolving into their own little persons. They're developing a strong sense of self-awareness, and with that comes the realization that mommy and daddy are separate from them. They definitely will recognize their primary caretakers and may get nervous around strangers or cry when you leave the room. This is very normal. They still depend on you for so much, and this separation can be frightening and frustrating. To ease your baby's anxiety, remember to say goodbye whenever you leave the house and don't try to sneak out. This way, he or she will learn what to expect from you. Separation can also be an issue at bedtime, but it's important that your baby learn to fall asleep on his or her own. For some children, a cuddly toy or blanket can serve as a transitional object. That is, a source of comfort that connects you to your baby and helps your anxious infant to relax. Give your baby this object during quiet times you share during the day, and then reintroduce it at bedtime. Your baby's babbling should be more advanced now, including 2-syllable combinations and new consonant sounds. Mama or Dada may actually become associated with the real people who answer to those names.
Mama.
Mama.
You can talk?
Beyond talking, a 9-month-old can engage in a wider range of social activities. Your baby will enjoy looking through picture books, taking objects from you, and even sometimes giving objects to you. As fine motor skills increase, your baby will also be able to pick up objects with his or her thumb and forefinger. And your 9-month-old will get great satisfaction from simple activities like banging toys together or taking things out of containers and putting them back in again. Some babies begin to crawl at this age, first on their tummies in a commando style, and then up on their knees. So, should you be concerned if your baby isn't crawling yet? Absolutely not. Some babies actually skip crawling altogether. But at this age, most babies can pull themselves up and hold on to furniture even if they don't move yet. A few babies at 9 months might begin to take their first steps. Most importantly, remember that each child develops at a different pace. Some walk early, some talk early. Others take a bit more time, and this is perfectly normal. Of course, if you have any concerns, consult your pediatrician.
Your baby will still need to breastfeed several times a day, or have about 24 ounces of formula a day. Continue using iron-fortified formula. Your baby will need 3 meals a day now, a combination of cereal, yogurt, fruits, vegetables, and meats. You may also begin finger foods and table foods now. Start with Cheerios and soft-cooked peas. Expand the menu with fruits or cooked vegetables, cut small, or mashed with a fork. Harder fruits like apples can be grated. You can also serve ground or grated meat. For interest, add yogurt and bits of cheese. You should not serve any honey, peanuts, or nut-containing foods, or egg whites. And never serve choking foods like grapes, raisins, hot dogs, or popcorn. Remember, we do not recommend juice, which is filled with empty calories and can suppress a baby's appetite for more nutritious foods. Establish a regular nap and bedtime routine and stick to it as best as possible. Your baby should be sleeping 12 hours a night and taking a morning and afternoon nap. When your baby wakes up and cries in the middle of the night, Give them a few minutes to settle down by themselves. If the crying increases, go in to check on them, but only briefly. And don't get into the habit of taking your baby into bed with you. You will be doing this for a long time. Keep the lights off and try not to make too much noise. Babies need their sleep, and even if they fuss, they will fall asleep. Listening to them cry is never easy for a parent, but teaching your baby how to sleep and allowing them to get this needed sleep is one of the best things you can do as a parent. Ask your pediatrician if you are having any sleep problems. Now let's review some safety tips.
These tips should help keep your 9-month-old safe and sound. Avoid falls. Babies this age are bound to get some bumps and bruises, but you can keep serious injuries to a minimum. Install gates at the top and bottom of staircases. And as before, never leave your baby unattended on an elevated surface. Prevent electrocution. Be sure to cover all electrical outlets and keep power cords out of your baby's reach.
Now let's take a look at some other safety tips.
Be aware of suffocation hazards. Tie plastic bags into knots before disposing of them. Secure window shade cords out of your baby's reach so they can't get wrapped around the baby's neck. Protect your baby from drowning. Keep your bathroom door closed and latch the toilet seat shut. And never leave your baby unattended in or around a swimming pool. In fact, swimming pools in homes with children of all ages should be kept gated and locked. Prevent poisoning. Move all medicines, vitamins, cleaning fluids, and other dangerous materials to high latched cabinets. Keep the number for your local poison control center by your telephone. This should be your first call if you believe your baby has ingested something poisonous. Learn CPR. Contact your local Red Cross for courses in your area. Hopefully you won't ever need to use it. Prevention is the best medicine.
Hi, my name is Kimberly, and I'm one of the nurses here at Washingtonville Pediatrics. Here are some reasons to call our office.
If your baby has a fever of 103 or greater, or has a fever of 101 or greater persisting more than 24 hours. If your baby is more irritable than normal. If your baby is not waking to feed or is refusing to feed. If your baby has vomited more than once. If your baby has a severe cough, wheezing, or is breathing faster than normal. If your baby falls and hits their head hard, especially if there is any loss of consciousness or there is a large visible bump or bruise.
Now let's have some fun with your 9-month-old.
A 9-month-old can truly play. He or she can interact with you and with toys and will respond attentively to your words and songs. Your baby knows you now and can understand some of what you say.
Doggy.
So now is a good time to start some language activities. Teach your baby his or her body parts. Name toys or favorite objects around the house. Begin to go over the names of animals and point out family members and pets in pictures and in person. Gradually, he or she will begin to associate the words with these people, places, and things.
Peekaboo!
Peekaboo is also a great game for kids this age, and believe it or not, there's a developmental logic behind it. The game helps relieve separation anxiety by showing your child that you reappear after each time you disappear. When your baby is a bit older, he or she will learn to pull down the blanket or hands in front of your face. This will give your baby a sense of control over the situation. Now that your baby is getting better at using his or her hands, you can introduce activities and toys that take advantage of that. Since your baby can now splash and clap and push and spin, you can add bath toys, blocks, pop-up toys, activity centers, and musical instruments to the toy collection. And if there's any room left in the toy chest, add a shape sorter. A 9-month-old's brain is developing the logic that puts the square peg in the square hole.
Thanks for watching. We'll see you again at your baby's first birthday.